Hi everyone, it's Dr. Garza. I wanted to check in with you all today for my Tuesday talk and kind of let you know what I'm seeing in my practice and how that relates to my patients' concerns and my families that I care for, their concerns. I know I talk a lot about mental health issues on this platform, and it has definitely been the focus of my practice the last couple of months, given just the current situation we're in. COVID, of course, has been really stressful for families, and that's trickled down to teenagers and young people. And right now, there are many young people that are dealing with high stress, anxiety, depression, feeling disconnected, feeling isolated. And it's been a really challenging last, several months. One thing I've seen in my teenagers that are mostly high schoolers, but also middle schoolers, is even though my patients, I would say the majority are going back to school in person, whether that's full time or in a hybrid model, as some of the local school districts are doing. It has been very stressful for them. Learning is not the same as it was before. The expectations are still really high. I have a lot of patients that are taking, several advanced AP classes and having to manage with partially in person, partially at home, self paced, what they call asynchronous learning. All of that is a lot for patients to manage, especially when it's just so different than how they've learned before. And so, school is a big focus for my high schoolers and middle schoolers, of course. That's, what they spend most of their day focused on, and it's a big source of stress and anxiety. So I've had many patients reporting anxiety, emotional symptoms as far as feeling like they have nervousness, they can't stop worrying, they feel racing thoughts, they can't sleep. And then often they have physical symptoms, physical feelings of anxiety attacks with feeling their heart beating too fast. They feel on edge, they feel like they can't breathe, there's tightness in their chest, and much of it stems from school stress, managing school during this time, and then just overall stress in the home. There are many families where parents may have lost their job or lost their health insurance. There are, illnesses that they could be affected by in family members. There's worries about, staying safe and limiting their exposure to COVID. And, for a young and developing brain, it's a lot for them to think about and to manage. So I plan to focus on mental health issues the next couple of weeks as we enter into Mental Illness Awareness Week, which is next week, because again, it's a central part of my practice right now in caring for young people. And you really want parents to be aware. I want parents to start some of those conversations, and help these young people and teens get the help they need. In our office, I spend a lot of time talking with patients about how they're feeling and how that's affecting them. And we talk about treatment. Some treatment is with therapy, which I always advocate for therapy. You've heard that from me before. And therapy may be available through our own office, through the two therapists that are part of our team, but also we work in collaboration with many therapists in the community as well. And then I talk to patients about ways to maximize their self care, work on building ways of coping with how they feel. And then sometimes we have to talk about medication. And I plan to focus on the medication piece so that parents really understand our approach when medications can be useful and almost necessary to keep patients safe. And then, really reassuring them what our plans are with medication treatment, since that's also something I do in my practice. Um, so I hear you, I see you. I know that this has been a hard time for parents to navigate some of the challenges that their teens are having, and also for my patients. Of course, I say in our office we're here to help guide parents and families towards the best care for their child and their teen. And like I mentioned, I plan to keep posting about mental health issues the next couple of weeks, really bringing some of this to the a table. And these are not always easy conversations to have, but they're really important ones to make sure, again, that our teens are safe and that they are getting the help they need and ultimately feeling better. That's what we do. Have a good rest of your day.